Welcome to This Is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and today's episode is part 3 of a 3-part series about ketones, diet, and beyond. So lifestyle, healthy brain aging, and Alzheimer's prevention. I'm joined by Dr. Mary Newport. Welcome, Dr. Newport.
Hello. Hi,
So in
Melissa.
part 1, we talked about how a Mediterranean-style diet can improve your lifespan and overall health and contribute to preventing and slowing down Alzheimer's disease as a lifestyle intervention. And then in part 2, we talked about other things that you could do, again, more lifestyle issues. Part 1, if you want to really understand what ketones are and how they are processed in the body, I would check out that episode. And so today we're going to be talking about supplements, the connection between certain infections, and if people have had a concussion or other head injuries, why are they at greater risk for developing Alzheimer's? So that was a lot from me. So before we launch into all that, maybe just give us another quick review of who you are and the work that you've been doing.
Okay. So I'm Dr. Mary Newport. I'm a physician. I practiced newborn intensive care for 30 years. And then my husband, Steve, developed early onset Alzheimer's disease. So that is how I became interested in Alzheimer's aging, what we can do to prevent it, and ketones. I subsequently did hospice care for 3 years, the opposite end of the spectrum, and then I did home health risk assessments for people on Medicare and Medicaid. So that's my background.
Okay. So let's talk about supplements. We've talked about different medications. We've talked about over-the-counter medications, but now let's talk a little bit more about kind of the vitamins and minerals and things that people may taking. How much should they be getting? How much is too much? But we don't have to go into a lot of detail because I'm sure you have some of this on your website too. So just kind of a skinny
Yes.
version.
Yes. Okay. So vitamins are nutrients, that we need in our bodies, but basically we have to take them to get them. So there are water-soluble vitamins, vitamin C and the B vitamins, and then fat-soluble vitamins, which are A, D, E, vitamin K. And, basically, if we don't get them over time, we can have a problem. It's best to get vitamins directly from food as much as possible, because the vitamins contain the natural forms. The foods contain the natural forms of vitamins that our body needs. And supplements that you get over the counter, multivitamins, fortification of certain foods like white flour, have synthetic forms of vitamins that are not the natural forms that we use in our body. So it's very important to try to get the vitamins as much as possible from the foods that you eat. If you're on, say, a low-carb diet, and you make it a Mediterranean diet, you'll get most of the vitamins that you need, but you might not get enough. And a lot of people do not get enough of certain nutrients. One example is choline. And most people may not have any idea what choline is, but choline is part of acetylcholine. It's a neurotransmitter that's important to learning and memory. We talked about that in the other one of the other segments. And half of American women do not get enough choline in their diet. It's also an extremely important component of cell membranes throughout your body, and especially abundant in the brain. Phosphatidylcholine is part of the cell membranes, and choline becomes part of that molecule, that very important molecule. So with foods, the richest source are eggs. Chicken eggs, other types of eggs are loaded with choline. If you eat a couple of eggs a day, you'll probably be able to meet your requirement fairly easily. It's found in other animal meats and chicken and things like that, as well as some in nuts, not quite as much in plants, but it's just important to get. And if you hate eggs or, you find that you're not getting enough choline, you can take something like soy lecithin or sunflower lecithin, which are capsule, very inexpensive. that has a natural form of this choline as phosphatidylcholine substances that your brain and your cell membranes can use. So that's one example of an.
And there a brand that you recommended for that? Because we can put a link to that as well. So you told me that when we talked.
There are many good brands out there, but I use Now. Use the Now brand, NOW. They're inexpensive. I've been using them for a lot of years, so I tend to use a lot of their products, but there are a lot of brands out there that are available.
Okay.
But sunflower or soy lecithin. If you're allergic to soy, you might want to go with sunflower lecithin.
Yeah, I mean, all of these recommendations have to be made in conjunction with a provider, because I know, like, my mom had breast cancer and was advised not to, take soy supplements just because of the type of cancer that she had. So I do want people to be sure that, first of all, read your book, but also to work with their providers. And again, your book is clearly Keto for Healthy Brain Aging and Alzheimer's Prevention. Because again, all of this stuff has to be kind of balanced, but I think everyone agrees that, whole foods and eating a healthy diet is kind of the building block. And then if you're not getting enough from your food, you can add these other supplements. So now let's kind of pivot and talk about the connection between certain infections and Alzheimer's.
Yes, there are many different types of infections that can increase brain inflammation, that can involve the brain and carry a risk for Alzheimer's or dementia. So avoiding infection is important, but getting vaccinated for certain types of infection can reduce your risk. There are studies showing that they can reduce your risk of dementia, and these include the flu vaccine, the pneumococcal vaccine for pneumonia. It covers, I believe it's 23 different strains of the most common form of pneumonia, bacterial pneumonia. And then COVID-19 infection, infection against COVID-19 could potentially reduce your risk of developing dementia. There are people with COVID-19 that have neurological effects on their nervous system and on their brain that do go on to develop brain fog and dementia, after having COVID. So it's very important to try to avoid infection in the first place. The hand washing, social distancing, things like that we learned. I personally feel that there's still, COVID is still out there. We are seeing in my area kind of a resurgence of it again here in Florida, probably after the holidays and the many people that come from many other parts of the country here. And I wear a mask when I go into a grocery store or anywhere, where there's a crowd. I have learned to live with it and, trying to get out more and do more things. But being careful. If I go out to eat, we go during an off time when a place is not so crowded, that type of thing. I recently attended a conference and I wore a mask the entire time. I did not get COVID, haven't had it, don't want to get it. And who wants the flu? I mean, the flu will put you down for 4 or 5 days, and the flu can actually have effects on your brain as well.
So 65 and older, the recommended vaccines are the annual flu vaccine, your Pneumovax vaccine, the COVID-19 vaccine, and your shingles vaccine. So being sure that you check in. So being sure that you're checking in with your provider, that you've gotten all of that health promotion stuff taken care of. And then, you've also mentioned to me, about dental, bacteria in your mouth. And so let's talk about, because, Medicare doesn't cover, eyes, ears, or teeth. And so a lot of people don't have, they don't have, dental insurance, but let's talk a little bit about the role that dental health plays.
Yeah, good oral hygiene is very important. There are certain dental pathogens that are involved in forming the plaque on the teeth that have been implicated as possibly causing or accelerating or contributing to Alzheimer's in some way. So good dental hygiene is very important. Getting good repair. If you have cavities, they're caused by these microbes in the mouth. So you want to keep your teeth in good repair. If you have a cavity, it needs to be filled. So regular visits to your dentist, brushing your teeth well, flossing, or using a water pick. I like that a lot myself. So just, basically good dental hygiene. And it is strange that Medicare, for some reason, the mouth and the teeth are not part of your body, they're considered separately,
Right.
but hopefully more programs will get, dental coverage.
Right. And you think about the consequence of not taking care of teeth. When you look at the cost that Alzheimer's disease is going to cost this country, it's trillions of dollars compared to just helping people take care of their teeth. But that's something that also needs to start pretty early in life.
Yes.
You can't wait till you're 65 and wait for Medicare to do that. So,
exactly.
So finding resources to connect if you don't have dental coverage is important. So now let's just talk a little bit about the role that head injuries and concussions can play. So I'll just let you talk a little bit more about that.
Yeah, head injury is a big risk factor for developing Alzheimer's and other types of dementia. A famous case was President Ronald Reagan. After he left office, he fell off a horse and he had a head injury. And shortly after that, he developed symptoms that became obvious that he may be heading to Alzheimer's. He did develop Alzheimer's, and he did end up passing away from Alzheimer's.
Yeah, he also was a football player.
Yes. So that may have set him up for it.
But he was the president that actually signed the first legislation around Alzheimer's disease into law. I learned this when I served in the Senate on the Special Committee for Aging. And he's actually our only president that has died from Alzheimer's disease. But back to, those are just like random facts.
Yeah.
So if someone's had an injury, how does that work?
Yeah. When you get a head injury, a concussion, basically you lose consciousness or there's some bleeding in that area of the brain, plaques and tangles will form in that injury, very similar to what happens in Alzheimer's disease. But football players, people that engage in other sports where they have head injuries, will have repeated traumas to the brain. They've documented, like in a young football player who passed away for another reason, they found 20 different injuries in his brain where he had plaques and tangles. It's called chronic traumatic encephalopathy, or CTE. It was identified, I want to say maybe 10 or 12 years ago by studying brains of football players. And so, we want to avoid head injury, and it's very common in older people to fall, to have falls. It's a horrible, it's a tragedy that you can have separated shoulders, fractures, and head injuries with a simple fall.
Broken wrist.
Yeah. There you go. I
tripped and fell. So yeah, that's how it goes.
Yeah. So when I did hospice every day, I got calls about patients that fell. And it can be tragic, when that happens. So, we need to be, very careful about that. If you're, so a simple thing that I've done in my house, I have these little night lights that light, their motion detector night lights. So if I have to get up to use the bathroom in the middle of the night, it will trigger that to come on, and it lights my pathway to the bathroom.
Yeah, and that would have been good. I might have seen my cat if I had done that.
Yep, exactly. And some people have a lot of little area rugs throughout their house. It's really common to trip on one of those. So you might kind of reevaluate that, how much you really need those. Just fall prevention. Some people who are older are quite weak, and they don't want to bother someone else to help them, to get up and use the bathroom or something like that. But take advantage of the help that you have if you're in that situation, and don't fall. And if you're younger and you're engaged in a sport where there's a likelihood of a head injury, you might rethink that. There are plenty of other sports where you don't have to worry so much about head injuries.
Right. And so that makes me think of, there's a thing called a home safety checklist, which I will put, in our chat. And then, this also, the fall risk ties back into the exercise. So if you're doing strength
Yes.
training, you also need to include balance and flexibility. And actually, when I was in the Senate, we were doing a hearing or preparing for something related to falls. And there's actually a program around how dance, there was like a dance exercise program where it really just kind of helped you get reacquainted with the floor. And I actually, heard the guy from Blue Zones talking the other day, and he was talking about most other cultures sit on the floor regularly, and they have to get up. And that you think about what it takes to sit on the floor and get back up. And I'm like, as Americans, we probably should get a little bit more reacquainted with the floor to prevent these falls. I mean, you think about Ivanka Trump, she passed away from a fall. So any of those, so all those things are important, and we'll include links to those. Any final words before we close out our series?
Well, just to remind everyone that, there are a lot of things that we can do. The experts say that 30 to 40% of cases of Alzheimer's and dementia may be preventable by making lifestyle changes, diet being number one, exercise a close number two, and then just many other things, getting adequate sleep. Well, we didn't talk about sleep apnea. If you snore or you don't feel like you got a good night's sleep, you could have sleep apnea. Treating that's one of the known causes of dementia is sleep apnea that's untreated. Controlling blood pressure, those types of things, or many other things that people can do.
Right. And so what I'm going to do one more time is recommend your Clearly Ketones book, and we'll have a link to this, in the description here on YouTube and in the podcast platforms and on my website, melissabphd.com. If people want to learn more about you and the work that you're doing, they can find you on your website, which is coconutketones.com, and your email is ketones08@gmail.com. And again, a lot of the things that we mentioned, I'll have hyperlinked in the blog on my website for people to learn more. So I really appreciate you being with me for this 3-part series and sharing your expertise and the things that you have learned, because I really do think that, diet, lifestyle, that those are really going to be our strongest weapons against reducing the number of people that end up with Alzheimer's disease. So thank you very much for being with me.
You're welcome. I couldn't agree more. And thank you so much, Dr. Batchelor, Melissa, for having me on.
All right. Thank you.
You're welcome.
Thank you for tuning in to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and if you'd like to learn more, you can check out my other episodes on my YouTube channel by subscribing and ringing the bell to get immediate notifications when new content comes out. In addition, you can also find the audio version of the podcast on Amazon Music, Spotify, iTunes, and Stitcher. Please feel free to leave an honest review, because more reviews mean more awareness of the podcast and helps us move towards an age-friendly world. If you have a comment or a question, you can visit my website, melissabphd.com. Go to the Contact Melissa tab, and you can leave me a voice message. You never know, it might just include your question or your comment in an upcoming episode.